You're having pain, but where is it coming from? Your hip or your back? Because low back pain can cause hip pain, and hip pain can cause back pain. But how do you differentiate the two? These overlapping symptoms can make identifying the cause of symptoms confusing, resulting in wrong diagnoses and ineffective treatment. And the good news is that you don't need any fancy imaging technology to do so, just some knowledge on what and where to look. And because there is not a single test that can properly identify either hip or back pain, diagnosis occurs with clustering of signs and symptoms and some helpful clinical tests. So in this video, I'm going to review key signs and symptoms that can help you identify where pain is coming from so you can make sure you're addressing the right areas. Hey everybody, welcome back for another episode of Physio Show. Common signs and symptoms of pain that are likely originating at the hip include walking with a limp as well as groin pain. These features have been reported to be 7 times more likely to be coming from the hip versus the back. So if you have these symptoms, it's a pretty high likelihood that you have hip issues. But I wouldn't stop there. You want to be sure. A useful test to further make sure symptoms are coming from the hip is called the flexion adduction internal rotation test. To perform this test at home, lie on your back with your knees bent. Place the ankle of the leg being examined on the opposite knee. Using your hand, gently guide the knee across your body. The test is considered positive if it elicits pain in the groin region. Another test available for assessment of the hip is known as the flexion abduction external rotation test. To perform this test, take the ankle of the tested leg and place it on the opposite knee. Gradually let your knee lower toward the ground while keeping your back flat on the table. If this produces discomfort in the groin area, it signifies a positive test, suggesting that the symptoms may originate from the hip flexor muscle or structures within the hip joint. On the other hand, if pain occurs in the lower back, it indicates a possible sacroiliac joint pain condition. Now those were some quick and easy ways to rule in a cause of pain coming from the hip. Now these next tests are useful for ruling out the back, meaning if they are negative, you can be more confident that it isn't coming from the back. The first assessment is called the extension rotation test, which is a test to identify if pain is coming from the joints in the lower back. To perform this test, stand up and take your hand and place it on the back of the opposite hip. Now slide your hand down your opposite leg, which will cause your spine to extend and rotate. Lack of pain suggests the pain is not coming from the joints in the lower back. Another test to perform to rule out the back is the slump test. This test is used to identify sensitivity of the sciatic nerve, which is commonly irritated with various back pain conditions. To perform the slump test, sit at the edge of the seat with your feet flat on the floor. Take up a slumped position by slouching your back and looking down. Slowly extend one leg, which tensions the sciatic nerve. If this doesn't reproduce your pain, dorsiflex your ankle by gently pulling your toes towards your shin to further tension the sciatic nerve. If the test does not reproduce your pain, then it's a negative test. The last test you can perform at home to exclude your back as the source of your discomfort involves repeated movement screen while standing. To perform this test, repeatedly bend forward with your knees straight, aiming to reach as far as you possibly can without allowing your knees to bend. Perform this movement for 10 repetitions. If this action does not reproduce or intensify your symptoms, it indicates a negative test. You should then place your hands on your hips and repetitively extend backward for 10 repetitions. I like to do this test against a table or countertop to block your hips so you are only extending your back. If this action does not reproduce or intensify your symptoms, it indicates a negative test. This assessment helps to determine impact of various spinal movements on your symptoms. If the symptoms do not change with either of these movements, then it's likely not coming from the back. These quick and easy assessment techniques can be utilized together to effectively differentiate hip and back pain. Well, I hope this video provided you with more clarity on where your pain is coming from. If you like this video, give it a like so it can spread to more people. And you can support our channel by subscribing. This will go a long way in helping us continue to provide you with everything you need to know about your body, how it works, and what it needs to keep moving.